This week on Healthy Living, we'll shed some light on the autism spectrum disorder. A cafe in Adelaide, Australia is making a difference in the lives of people with autism in need of employment. And we'll have more on the N3N8 bird flu virus. Plus, can drinking coffee affect your heart's health? These stories and more in this edition of Healthy Living. Hello and welcome to Healthy Living. I'm Mkamiti Kiyabasi. Autism spectrum disorder affects 1 in every 100 children worldwide, according to the World Health Organization. People with autism often struggle with communication, eye contact, and social interaction. The conditions and needs of autistic children and adults may differ from one person to another. Autism disorders include early infantile autism, Asperger's syndrome, and pervasive development disorder. Autism poses a special challenge in Africa, where many parents are confronted with the lack of diagnosis and adequate resources. Observers say stigma, myths, and misunderstandings complicate access to the proper care. In the Republic of Congo, some parents and educators are taking some steps to draw more attention to the developmental disorder.
In her living room in the Republic of Congo capital Brazzaville, Ngwembe Laskine Chalvi plays with her 7-year-old autistic daughter, Lucia. Chalvi discovered Lucia's condition when she was 4 years old. Lucia attended the same school as her older brother. It is where one of the teachers raised the issue of Lucia's cognitive abilities. The parents decided to see a neuropsychiatrist who confirmed that Lucia was autistic.
At the beginning, it was difficult for me because it was the first time I learned that there were abnormalities that could be called autism.
Lucia's parents began to take her case more seriously. They followed the doctor's advice and tried to see what Lucia wanted to do. The mother designed a special program for Lucia, which includes going to the park where the 7-year-old plays and speaks to animals.
She feeds the monkeys, and we hear her saying, "Baby monkey, take, this is for my little baby monkey, don't be bad." And in this case, she can talk.
To draw attention to the condition, parents of autistic children organized an awareness campaign at the Case Dominique School. The school is administered by the Religious Sisters of St. Martin and takes care of children with autism and Down syndrome. Inaugurated in 1999, the school welcomes more than 300 students.
The objective is basically to touch the Congolese and tell them that an autistic child is a child like any other, a child who must be welcomed, who has rights, and whom we must try to understand in order to better accompany him.
Autism is a human development disorder characterized by social learning and communication difficulties, with stereotyped behaviors, highly repetitive gestures, and lack of coordination of movement. There are no official statistics on the number of autistic children in the country. In the Republic of Congo, autism is considered a mystical disease with witchcraft origins. Prejudiced attitudes push some parents to hide their autistic children.
Today, there are still parents who keep children at home because of shame or for fear that people will judge them, but I'm not ashamed. I told her father on the phone, I'm not ashamed for my daughter.
Dr. Paul Rukabyarwema, pediatrician at Muhima District Hospital, Kigali, discusses some challenges faced by patients on the autism spectrum.
The children with autism spectrum disorder, they have difficulties of speaking or expressive communication, which we always defined by speaking, but also not only speaking, but also non-verbal communication. So children with autism, they have difficulties also in this component of communication, interaction, to share enjoyment, to smile to each other, to interact reciprocally. This domain also is affected for children with autism. And by behavior then, they have also this abnormal behavior, or what we call stereotypic behavior component. Like, if I can mention some of them, the children with autism, these are the children who can like to display repetitively the same thing. They want to stay on the same thing persistently, where like to shift from one activity to the other activity, it is very difficult from them. Another component of this stereotypic behavior, they can display some sounds, they can jump. Pediatric Academy Association recommended to screen at 18 months of age, and then later at 24 months of age, and then at 32 months of age. So at these ages, then trained pediatrician or trained medical staff can detect some red flags of developmental problems that may be in favor of autism spectrum disorders. If you see your child is not looking at your eyes, if you see your child is not pointing to some object, if you see your child is not playing with you, like socially, to interact with you, or if you see your child is persistently keeping himself in the same condition, he doesn't want to change from this condition to the other, what we call persistence in the sameness, there might be something wrong. Early detection and early intervention can change the spectrum or may influence the outcome. So the detection, this is one of the challenges, because most of the time these children are seen or diagnosed at later age, as I said, more than 3 years or even more, because they didn't get a chance to know what is autism or this condition exists. This is not specific for Rwanda, it is for many countries or for many African countries, not even only African, but also globally in other parts of the world. As the autism spectrum disorder is a lifelong condition, the care of this condition is very difficult or challenging, not only in Rwanda, but also globally, because it is a multidisciplinary component of it approach to tackle this condition. The third challenge is the belief or the knowledge, the level of knowledge of many people, where they may associate or think the condition that their child have is due to other things, due to their belief and also their level of awareness.
A cafe in Adelaide, Australia is helping young people with autism by training them to work in the hospitality sector. About 100,000 Australians are affected by the condition, and they often have difficulties finding a job.
Cappuccino large.
This young man is in training here at the Shine Like Gold Mobile Cafe, where autistic youth like him are being taught precious work skills.
Last name for Valentina.
Thank you. This scheme is the first step in Davis's career. Employees like him are paid award rates or minimum pay rates, and any profit the cafe makes is used to help other programs that support autistic young people. People with autism may have learning difficulties, problems with interacting with others, and more generally, dealing with the environment they find themselves in. In a report published in 2019, the Australian Bureau of Statistics pointed out that people with autism were 8 times more likely to not be working than non-disabled people. But the hospitality sector currently has numerous vacancies.
I think with the challenges that we're seeing today with workforce shortages, I think young people on the autism spectrum have a lot of potential that can be leveraged by employers.
Pangalo, who is also affected by autism, manages programs like the Shine Like Gold Mobile Cafe to build young autistic men and women's confidence and to help them find jobs.
I see them really come out of their shell. I see them shine like gold, quite literally.
Davis's dream is to find an office job, but right now he's happy to just make coffee and meet new people. And customers are happy to buy a perfect cup of coffee from him.
The World Health Organization says a Chinese woman has become the first person to die from a type of bird flu that is rare in humans. However, the strain does not appear to spread between people. According to the WHO, the 56-year-old woman from the southern province of Guangdong was the third person known to have been infected with the N3N8 subtype of avian influenza. All of the cases have been in China, with the first 2 cases reported last year. New research is shedding some light on the effect of coffee on your heart.
Coffee lovers and their doctors have long wondered whether a jolt of Java can affect the heart. New research published recently finds that drinking caffeinated coffee did not significantly affect one kind of heart hiccup that can feel like a skipped beat. But it did signal a slight increase in another type of irregular heartbeat in people who drank more than 1 cup per day. It found that people tend to walk more and sleep less on the days they drank coffee.
The significance of people having a few extra heartbeats, so in this case it was about 50 over the course of the day on the ventricular, so that's the main pumping chambers of the heart side, and no difference on the other side of the heart. That difference is not going to make a much difference clinically or in someone's health over the course of a long time.
Coffee has been associated with multiple health benefits and even a lower risk of death based on large studies that observed participants' behavior. Despite research that has shown moderate coffee consumption doesn't raise the risk of heart rhythm problems, some professional medical societies still caution against consuming caffeine.
I mean, the main question people want to know is, should I drink more coffee or start drinking it if I haven't already? And I'm not sure that that will be easy to answer until we have a lot of very comprehensive electronic health data that we can kind of compare over time and look at populations compared to similar people.
Because the study was performed in a small number of people over a short period of time, the results can't be applied to the larger population, Dr. Kao says.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on Twitter at Mkamiti VOA. Until next time, stay well and strive to make every day a healthy day.
In times of change, when the world seems uncertain, and what we hear doesn't reflect what we see, we seek the truth. When we are told only part of the story, we lose trust. In moments of crisis, our dreams, hopes, and wishes for a better tomorrow depends on a free press. At Voice of America, we bring you the stories that people take risks to see. We connect the world and unite it with truth. At Voice of America, we show you the whole picture.